Good. So that released. Psoas and iliacus are fairly deep muscles, but the trigger points can be found near the surface along the inguinal ligament where the psoas is closest to the surface, and also just inside the iliac crest where the iliacus attaches. We'll start first with the psoas, and it's usually not difficult to find trigger points right in here. Is that tender?
Mm-hmm.
Okay. So what we do, since the psoas does hip flexion, is we will flex the hip, but it also does external rotation. So we'll rotate the hip like this. How's this feel now?
Good.
Okay. And I find it usually works best getting the knee directly over the point and then adding compression. And we can hold that for 30 to 90 seconds. And you can often feel it let up under your fingertips. Okay, and we'll let that back down. And how's that feel now?
Good.
Good. Now iliacus, we can find points right up in here. How's the spot here?
A little tender.
Okay. And the treatment is very similar because the action is the same. You can bring the knee up toward the point and externally rotate like this. How's this feel?
Good.
Good. So again, we'll hold that 30 to 90 seconds. You can breathe into it. That's good. And we feel it letting go. And we can bring it back down. And the referred pain pattern for these muscles, by the way, is down the front of the thigh, but also around the low back. Trigger points on the quadriceps are often found on the distal end of the quads. You can find trigger points on the vastus medialis, toward the inside, or on the vastus lateralis, on the outside. Let's see. How's that feel there? Tender? Okay. Now there's a couple different ways that we can counterstrain this. One would be to actually shorten the quads this way. How's that?
Okay.
Okay. But I find this kind of hard to hold, especially on a larger person. So another way that we can do it for shortening the muscle is to cave in around the muscle like this. How's that feel?
Good.
And that works very well, and it's a lot easier for body mechanics. So I'm still holding the point, and we can hold it for up to 30 to 90 seconds. And then as you feel the point release, and bring it back like this. And how's that feel now?
Fine.
Good. Trigger points can exist in the tibialis anterior, particularly with overuse syndromes, such as with shin splints. And they're not difficult to find. You just go along the lateral edge of the tibia, usually right in here. Is that tender?
Mm-hmm.
And the pain pattern will go down toward the big toe. Now to counterstrain this, what we do is dorsiflex the foot and also invert the foot. How's that feel now?
Better.
Good. And so we can hold that again for 30 to 90 seconds. That can allow that to release. How's that now?
Good.
Good. Boy, that was a hot point. Some trigger points can be worked with the client in a seated position. One of these would be the rhomboids in here. You can just find a tender spot. How's that feel?
A little tender.
A little tender. And then counterstrain it this way by pulling the shoulder back and down toward it. How's that feel now?
Good.
Okay. Then we can just hold that until we feel it release. And then as it releases, come back out. How's that feel now?
Better.
Good. Points in the neck can also be worked this way, in the neck or the top of the shoulder. Find a tender spot. How's that?
Mm-hmm.
We'll rotate the head toward and flex it toward. How is it in this position?
A little better.
How about like that?
That's good.
Good. And then whatever part of the head is on top, we press down toward the point. And again, we can hold that anywhere from 30 to 90 seconds until we feel it release. And then as we feel the point release, let it come back. How's that feel now?
That's better.
Good.